Have you thought about the importance of your toes? I have had toe problems for a few years now. Badger wants to play with these balls, they're not for him. I have been diagnosed by my podiatrist with something called Hallux rigidus, which a lot of people might have, and it's kind of known as arthritis of the big toe, or rigidus just means stiff. It means there's a stiffness in the joints, and so therefore it's not even so much when you think about your different toe joints. So there's this joint. I don't have a pedicure, sorry about that. It's not pedicure season. Or this joint. This is the joint that's more painful for me and lacks some flexibility. This joint seems to bend okay, but when you wear high heels, try to wear high heels or do other things that require a lot of bending of the toe, it's not very flexible, so it won't go back very much. So therefore you get pain when you try to bend it by, let's say, again, wearing a big high heel or, just lots of other activities like walking, walking fast. And so it gets a little better if I do less things that irritate it, obviously. And it flares up if I do wear high heels out to like a wedding or something. And it got to the point that it really kind of was reddish and swollen. And I had, sometimes I take over-the-counter anti-inflammatories. I also had these anti-inflammatory patches that is diclofenac is the name of the medication, but my podiatrist gave them to me, where it's just a sticker you put right on top of that, and so topical anti-inflammatory going right in. That helped some when I was having flare-ups, but nothing helped a ton. Well, I have been getting acupuncture lately, and the acupuncturist has a massage therapist who she always has to do massage for like 15 minutes before the acupuncture starts, because she thinks it helps it be more effective, helps you relax. And this past time I asked for a 30-minute massage instead of 15 minutes, and I told her I wanted her to focus on my legs, because I've been having problems with this left leg, of course, with my knee surgery and just the tightening I was having in my hamstring, all the things. But even laying on my stomach hurts. It hurts right here when the surface touches the mat or bed or whatever. It's just my toes. I always tell them whenever I'm going to a doctor, I say, my toes are my biggest problem right now. And so she massaged the heck out of my toe area. I will tell you, I was practically crying, and she kept asking, "You want me to stop?" I was like, no. But it was, just so incredibly painful. But it felt painful in the way that was like doing something, like capital D-S, doing something. And so I will say, see, you can't tell because you didn't see them before, but my toes look different. This is not nearly as swollen. The whole thing looks more normal, just more normal. So I'm gonna have her do it again this week. I'm gonna do it as often as needed to I think completely break up the stuff. When I say she was massaging my toes, so it's not really just massaging my toe. So she was just going to town on this part, whole thing up and the side and all around. And so one of the things that, I don't know if she was using one of these now, but the scraping tools, I talk about that a lot too. So, you can do a lot of this kind of thing at home yourself, whether, and I have these different scraping tools. These are small tools. They're actually supposed to be for your face, gua, something, right? I have my big one that I use when I'm doing scraping. So again, Google or go into chat, type in scraping and say how wonderful it is. It's really all the different modalities, whether it's the massage stick, or I've got my Roga, see that blue thing over there? That's basically a foam roller that has ridges, and I use that every day too. I spend the first 10 minutes of my morning doing things, whatever of the day I feel like it, of scraping or rolling or something that's to kind of help break up the fascia adhesions and things like that. So, but again, I am going to now every morning take off my socks, and it's not just So not just massage, but moving the joint. So this is the thing she's doing too, just kind of moving the joint back and forth, pulling it in and out, up and down. Really a good thing to do. And I mean, when you're talking about trying to create comfort in your body and ease the things that are bothering you, you know, it's good to just keep investigating, finding what's going to work, finding relief so that you can live your active life, do the activities that you want to do. So for me, it's paying attention to my toes. And you know, they always say, a lot of professionals say, it starts with your feet. And my toes were the first problem I have, and I'm pretty sure that my toes, the problem with my toes could be what contributed to all the problems I've been having with my left knee and all the way up, because the physical therapist last week had asked me, she's like, you know, when you're walking, make sure your heel strike and rolling all the way through off the ball of your foot. And when she said that, I started noticing when I was out doing a walk, like a brisk exercise walk, that I wasn't doing that because my toes hurt, I was kind of landing and I was almost holding my toes up inside my shoes the whole time I'm walking. So I wasn't rounding through. So if I'm holding them up all the time, I'm contracting these muscles. They're not getting relaxed and the joint is not getting the movement it needs to be as flexible as it can be. So, you know, I'm going to make sure that I take my socks off and then I move this toe around, both of them. Both of them. But I do both feet because they're both equally sore. And to try to keep my toes as mobile as possible. One thing I forgot for the toes and feet in general is balls. Okay, you can use balls to kind of step on and roll through. That's a bigger one. You can use this is a small one. Actually, that feels really good. That might be one of the best ways that you can do self-massage on your toes, is using balls.